I'm Tara, the CME at Five East. I want to show you how to get your bed ready for a post-op patient. So you've just taken a report on the phone and your post-op is coming back. So let's get our bed ready. First thing I grab, thermometer, because you got to do your vitals a little more frequently. We're going to need wipes to clean up that prick. And always a thing of water, depending on whether or not your patient is NPO, but usually we bring some nice ice water. Okay, you're going to move your side table. Sometimes I like to put it right against the wall. Rooms are tiny, so we have to move some things around, okay? We like the bed nice and high so that when the stretcher comes in, it's ready to go. And you're gonna pull your blankets down to the end. And that's pretty much it. You wanna make sure that your suction is always hooked up so you've got your tubing and everything you need just in case an emergency happens, and that your vitals machine and everything is all here and you have an IVAC to hook up to it. Now, each surgery has different needs. So the other things you can prepare before you come are here. So if you're getting a TURP patient, they sometimes need more supplies. So I like to use the half pad absorbent sheet under them because we don't have soakers anymore. This is really absorbent. The slider sheet is there, but it's not super absorbent. You're gonna need a TURP pole for those CBI bags, and then this sits on the floor to collect all the fluid. And in the nightstand, there should be clean gown and face cloth. If there's not, double check and grab one just in case, because usually there's some spots of dirtiness and we just want to change it. A lot of our gynae patients that come back, we need to measure their voids. Most post-op patients we want to measure their voids, so you're going to need a hat. What's really important about these hats and these containers is that you label them. Not so much with the patient name, but I like to label them with the bed number. So in this case, we're in 65-1 and my patient's coming back to this bed. If they have a Foley, this is the container we like to use to collect that. So again, I'm going to label it 565 bed 1. We don't want to get these containers confused between two patients because, okay, our gynae patients always need a fresh pad because we want to keep an eye on their PV flow. If you have a patient coming back with a drain or multiple drains, you're going to want as many cups as they have drains. And again, you're going to label it with the room number, and let's say this one's for the left JP drain, and I'll get a second one for the right JP drain. Now, you want to have your bed all ready to go, so let's say if you need to go for break, or you went for break and all of a sudden your patient's coming back sooner than later, your bed's ready for the covering nurse, and it's easy peasy for the unit. Thanks for watching. Bye.